Which of the following may be considered a patient's right? Option number A, the right to euthanasia. Option number B, the right to refuse treatment. Option number C, the right to ignore hospital regulations. And option number D, the right to refuse to pay for what the patient considers to be inferior service. The answer is option number B, the right to refuse treatment. Under the Bill of Rights law, the patient has the right to refuse treatment or life-giving measures to the extent permitted by law and to be informed of the medical consequences of his action. The average daily amount of urine excreted by an adult is, first, option A is 500 to 600 ml. Option number B, 800 to 1400 ml. Option number C, 1000 to 1200 ml. Option D, 1500 to 2000 ml. The correct answer is option D, that is 1500 to 2000 ml. An adult's average urine output ranges between 1500 and 2000 ml per day. Next question is, the correct site at which to verify a radial pulse measurement is the option A, brachial artery. Option B, apex of the heart. Option C, temporal artery. And option D, inguinal site. Here the answer is option B, that is the apex of the heart. The best site for verifying a pulse rate is the apex of the heart, where the heartbeat is measured directly. Next question is, a sudden redness of the skin is known as A, flush, B, cyanosis, 3, jaundice, and D, pallor. Here the correct answer is option A, that is flush. Flush is a sudden redness of the skin. Okay, then cyanosis is a slightly bluish-gray skin discoloration caused by abnormal amounts or reduced hemoglobin in the blood. Then jaundice is a yellow discoloration of the skin, mucous membranes, and sclera caused by excessive amounts of bilirubin in the blood. Then pallor is an unnatural paleness or absence of color in the skin, which indicates insufficient oxygen or excessive carbon dioxide in the blood. So here the correct answer is flush. Flush is the redness of the skin. Next question is, the nurse is preparing to take vital sign in an alert client admitted to the hospital with dehydration secondary to vomiting and diarrhea. What is the best method used to assess the client's temperature? Option A is oral, B is axillary, C radial, and D heat-sensitive tape. So here the correct answer will be axillary, because the person is having vomiting. Then radial and heat-sensitive tape, these are not used for taking the temperature. So here the correct answer will be axillary. Next question is, it is a transparent membrane that focuses the light that enters the eye to the retina. First option is lens, second option is sclera, third option is cornea, and the fourth option is pupils. So we all know that the answer is C, that is the cornea. It is the organ, or it is the membrane that focuses the light that enters the eye to the retina. Next question is, the nurse administers cleansing enema. The common position for this procedure is option A, Sims left lateral, option B, dorsal recumbent, option number C, supine, and option number D, prone. So while doing the enema, we should always do in the Sims left lateral position. So the correct answer to this question is option A, that is a Sims left lateral position. So the next question is, the first techniques used for examining the abdomen of a client is option A, palpation, option number B, auscultation, option number C, percussion, and option number D, inspection. So here the correct answer will be option number D, that is the inspection. While examining the abdomen of a client, we should always begin with inspection. Next question is, back care is best described as option number A, caring for the back by means of massage. Then option number B, washing of the back. Option C, application of cold compress at the back. Option D, application of hot compress at the back. Here the correct answer will be option A, that is caring for the back by means of massage. Back care means by means of massage we have to care for the back. Next question is, the ELISA test is used to, first option, screen blood donors for antibodies to human immunodeficiency virus, that is the HIV. Option number B, test blood to be used for transfusion for HIV antibodies. C, aid in diagnosing a patient with AIDS. D, all of the above. Here, the correct answer will be option D, that is the all of the above. That means it will screen the blood donors for antibodies to human immunodeficiency virus, test blood to be used for transfusion for HIV antibodies, aid in diagnosing a patient with AIDS. All of these functions will be done under the ELISA. The next question is, clay-colored stools indicate A, upper GI bleeding, B, impending constipation, C, an effect of medication, D, bile obstruction. Here the correct answer is D, that is bile obstruction. So bile will color the stool brown. Any inflammation or obstruction that impairs the bile flow will affect the stool pigment, yielding light clay-colored stool. Upper GI bleeding, in the other hand, will result in black or tarry stool. Constipation is characterized by small hard masses. Many medications and foods will discolor the stool also. For example, drugs containing the iron will turn the stool black. Beets will turn the stool red. So like this, the bile will cause the brown coloration of the stool. The next question is, the nurse explains to a patient that a cough, A, it is a protective response to clear the respiratory tract of irritants. B, is primarily a voluntary action. C, is induced by the administration of an antitussive drug. Then D, can be inhibited by splinting the abdomen. So here the correct answer is A, that is, it is a protective response to clear the respiratory tract of irritants. So a cough is caused when there is any protective response from our body to clear the respiratory tracts of any. Then next question is, all of the following measures are recommended to prevent the pressure ulcers except A, massaging the reddened area with lotion, B, using a water or air mattress, C, adhering to a schedule for positioning and turning, D, providing meticulous skin care. Here, the correct answer will be option A. That is, nurses and other healthcare professionals previously believed that massaging a reddened area with lotion would promote venous return and reduce edema to the area. However, research has shown that massage only increases the likelihood of cellular ischemia and necrosis to the area. Next question is, in the Maslow's hierarchy of physiologic needs, the human need of greatest priority is given to A, love, B, elimination, C, oxygen, and C, nutrition, and D, oxygen. Here, the correct answer will be D, that is the oxygen. So Maslow defined a need as a satisfaction whose absence causes illness, considered oxygen to be the most important physiologic need. Next question is, which of the following parameters should be checked when assessing the respiration? First option is rate, second rhythm, third symmetry, D, all of the above. So here The correct answer will be D, that is all of the above, because while assessing the respiration, we should check all the parameters like rate, rhythm, symmetry. Next question is, which of the following vascular system changes results from aging? Option A, increased peripheral resistance of the blood vessels. B, decreased blood flow. C, increased workload of the left ventricle. D, all of the above. Here the correct option is D, that is all of the above. Aging decreases elasticity of the blood cells, which leads to increased peripheral resistance and decreased blood flow. These changes in turn increase the workload. Next question is, from which part of the brain secretes the cerebrospinal fluid? A, from the choroid plexus of the brain. B, from the venous sinus of the brain. C, from the subarachnoid space. D, none of the above. So here the correct answer will be from the choroid plexus of the brain. The cerebrospinal fluid will be secreted from the choroid plexus of the brain. So cerebrospinal, it is a clear fluid, clear colorless liquid that fills and surrounds the brain and the spinal cord and flows through the brain and spinal cord. So this fluid will be secreted from the cord. So the next question is, which of the following is the meaning of PRN in capital letter? So the first option is when advised. B, immediately. C, when necessary. D, now. Here the correct answer will be C, that is when necessary.